coronavirus. This phase is not unexpected, but it is tragic nonetheless. Yesterday, Ohio had its first death from the coronavirus. And it was someone who both John and I knew very well, liked very much, respected very much. Mark Wagner, Sr., prominent attorney in Toledo, someone who had been on the Board of Elections, someone who had been prominent in the Republican Party. Mick was very well respected and so much very liked by everyone who knew him. And so Fran and I, John, Tina, all of us extend to the Wagner family our deepest sympathy. To his wife, Jo, we're so very, very sorry. To his children, Mark and Greg and Paul, Meredith and Jennifer and Nick, who have lost their father-in-law, and to his 7 beloved grandchildren. When we hear about these deaths in other states, as we hear about them in Ohio, many times, most of the times, we will not know that individual. It'll be another number. But I think it's important for us to remember that each time we hear about a new death, that is someone who was loved, someone who lived their life, someone who wanted to live longer, someone who was cherished by the people in their family and in their community. When confronted with the finality of death in our Judeo-Christian tradition, we often turn to the Scripture for comfort. The 23rd Psalm, so often read at funerals, tells us that, yea, though I walk through the valley of the shadow of death, I will fear no evil, for thou art with me. Thy rod and thy staff comfort me. The beginning of the psalm is also well known. The Lord is my shepherd, I shall not want. And so to my fellow Ohioans, for a while it's going to seem like we are in fact living in the valley of death. It will seem like we're living in the valley of that shadow. But we will get through this. We will get through this. The sun will shine again. It will be spring again in this wonderful, beautiful state of Ohio. I want to take a moment, because this is, as I hear about the story of the nursing home in Miami County, and I think of all the first responders who in time of crisis like this, but also every day, risk their lives. I want to thank them. I want to thank all our first responders. I want to thank everyone in the medical community, everyone who is working, battling to keep people alive, working so very, very hard in preparing for what will be coming in the days and weeks ahead. You're our heroes. We are grateful for everything that you're doing. We're grateful for everyone who is working so very hard as we go through these difficult times to keep Ohio moving, whether it's feeding us, clothing us, making sure that we have the medical care that we need. Thank you. I'm proud of each and every one of you. I'm grateful for what you do. We have a few announcements today. I want to start by thanking the Chief Justice who was here yesterday for what she said, directive that she sent out today. And I just would appeal to all our judges, all those involved in our judicial system, to heed the words of the Chief Justice, to do everything that you possibly can not to have gatherings of people at the courthouse. Justice must continue. The Chief has put out, I think, a very, very logical, well-reasoned directive, and I would just ask everyone to please, please follow that for the safety of all our citizens. Let me talk a moment. Ursel was here yesterday and talked a little bit about the Department of Aging. I want to announce an executive order that I am signing today that will go into effect at close of business on Monday. Close of business on Monday. First of all, this affects our senior citizen centers that are really so often the heart of the community and do so much good. As we've talked about often, it is a significant risk for anyone to be in a group setting. That certainly includes our senior citizens. And yet, our senior citizen centers provide some very, very, very important support. These centers will close on Monday at close of business, but I am assured that each of our senior citizen centers has taken care to make sure that the congregate feeding program, where the seniors gather there for lunch, that these same seniors will be able to get this food, and that will be delivered to their homes. So I'm grateful for everyone, the volunteers, and everyone who's worked so very hard to make that happen. Other services that can be provided by the senior citizen center can still be provided, and we hope will be provided. Transportation, I know, is so very, very important. I know in many of our local senior citizen centers that I'm familiar with in Greene County, they provide transport for seniors to doctor's appointments and other vitally important things in their life. We would hope that those would be able to continue, and the senior citizens would continue to be helped. The centers would continue to help our seniors by doing that. Let me also talk about another part of that executive order. And again, we talked a little bit about this yesterday, and that is our senior daycare centers. These centers provide very, very important care for some of our seniors who cannot stay at home by themselves, seniors who live generally with family members, and the family members are gone during the day working. And this provides assistance for the seniors and assistance for those family members. Again, our grave concern is about the danger of those seniors being together and the spread of disease, spread of this virus. So these will also be closing on Monday. We have been telling these providers that this day is coming. Ursel assures me that they have made provision for each of our seniors. We wanted to give a few more days now that we're making the final order. Well, it's an order that we've been signaling for some time, but today making that final order, and so we would believe that by close of business on Monday, each one of those seniors who is getting service will also be able to continue to get service in a different setting. Throughout this crisis, I have tried to balance the safety of the people of the state of Ohio, but also tried to achieve continuation of essential services, continuation of allowing people, when possible, to continue to make a living, provide for their family, and to keep our economy moving. I'm fully aware that some of our orders have caused people to lose their jobs. I fully understand that. Each one of those orders was thought out, agonized over. I made those decisions because I felt that the evidence was abundantly clear that those decisions would save lives, would protect lives. We are seeing in the news steps that have been taken by other states, Pennsylvania, California, in regard to the closing of additional businesses. We continue to work to find the right balance. Let me just say that I want to thank the businesses in this state that have gone out of their way, that have done everything they could to comply with the best safety precautions, separating people, making sure there's sanitizer everywhere, making sure when that employee comes in, there's a discussion with that employee. How are you feeling? Are you okay? Businesses that have asked the employees to take their own temperature at home, businesses that have the thermometers that can take the temperature as they come in. We have some real heroes out there in the business community who are really, really focusing on that. And so I thank you. What you're doing every day is saving lives. There's absolutely no doubt about that. Sadly, I also, though, continue to receive more this morning, emails, texts from employees, from people who have observed what's going on in other businesses, about businesses that are not compliant, businesses that are recklessly risking the lives of their employees' families, and everyone that those employees and their families come in contact with. This simply must stop. I implore you, please do what is right. As I continue to balance my responsibility to the people of the state of Ohio, the responsibility when I took an oath of office to do the essential thing that government does, which is to protect the people. As I balance that with our attempt to keep this economy moving, let me make it very, very clear that I will err on the side of protecting people. So, no announcement today, but the bad behavior, the reckless behavior must stop. And I congratulate all those who are out there who are making a difference every day. The businesses that are mindful of what they need to do to protect their employees. The evidence shows that when businesses do this, when they're very, very aggressive, they can protect their employees. So I would ask, please do that. I continue to balance this. I continue to look at this every single day and make the decisions which I think are best interest of the people of the state of Ohio. But the sanctity of life, the protection of life, is the most important obligation that I have. Let me now ask Dr. Acton to come up and to give her update on what she is seeing around the state of Ohio. Thank you.
Thank you, Governor, and good afternoon, everyone. And I share again my deepest condolences to the Waggoner family. We today have 169 cases, age range onset, illness onset from February 7th to March 18th, age range 1 to 91 years of age, with a median age of 49. 69 females, 100 males, our first death, and 39 hospitalizations. We now have cases documented in 28 counties. And I will say that to the media, I know that you might be hearing stories of potential other deaths, and those investigations are still ongoing. I really want to take a moment to talk about the incredible work that's being done around the nursing home in Miami County, and to the work being done by the local health department, Health Commissioner Ropes, and his colleagues in nearby counties. This is a difficult situation, and I want to speak a bit about our frontline healthcare workers, the folks who work in nursing homes. I can imagine how fearful it is and how afraid families are when you hear of an outbreak where someone you love is. And the people who are doing this work, are going to be exposing themselves to COVID, and they're still coming and still going to work. These are the everyday heroes that we're talking about. I've heard stories, and I've asked for a picture I'm going to post on our website, a beautiful illustration of these folks on the front lines. But these are the folks, sometimes they're folks I'm hearing that work in nursing homes that are facing some stigma just because people know that they work in a nursing home. And it's the opposite. These folks are following all the rules we've set for them. We need to thank them every second. We need to help them keep doing their job. It's so vitally important, especially in a situation where people are scared, as in this particular location, that we bolster everything, that we drop off more food. I heard a sad story of a bakery delivery that was stopped out of fear, and that's the opposite of what we should be doing. That's not science, that's fear. We need to make those deliveries. We need to deliver that food. We need to encircle that community with all the help we can give them. And so I want to thank everyone out there on the front lines of what is our first, nursing home cluster. I also want to thank the people that are working in my emergency operating center. I visited the emergency operating center yesterday to meet with my team and teams from a number of areas across the state who do the incident command structure to help those on the front lines. One of the hard things about this is we'll have many different things going on around the state at one time. And these are also essential workers who have to come every day, who face, again, the risk of infection spread. They follow all the protocols as they do in business, but they have to keep showing up, just like our hospitals and our nursing homes have to keep coming to work every day. Our people delivering food have to keep coming. We thank you, and we'll do everything we can to support the folks who need to be there. And the rest of us staying home right now is absolutely essential. I think I'll stop there for today. I do want to remind everyone, please keep going for good information. There's so much misinformation out there right now. Coronavirus.ohio.gov, our helpline. We take your calls as quickly as we can. We know with the thought about these deaths, there might be worries you have, and you can reach out if you feel you need to talk to someone. We're not alone. We're physical distancing. We're not social distancing. We're going to reach out to help each other. 833-4-ASK-ODH if you need to talk. Thank you.
Good afternoon. I do want to start by expressing my condolences to the Wagner family. Mick Wagner was a friend. I had appointed him to the Board of Elections when I was Secretary of State. He loved his country, he loved his state, his community, and certainly his family, and he will be missed. To start off, I want to focus on a couple of things that are happening to help the employers and the employees in the state. As you know, the Governor DeWine declared a state of emergency in Ohio. And as a result, that authority has, through that authority, the Department of Insurance is issuing an order requirement for insurers in the state that would allow employers to take care of their employees with a grace period for insurance premiums. The grace period is for all health insurers, and it must provide the option of deferring premium payments interest-free for up to 60 calendar days from the original premium due date. This means that employers can defer their premium payments for health insurance for up to 2 months. We hope that this will give them some relief during this time, and health insurers must allow employers to continue covering employees even if the employee would otherwise become ineligible because of a decrease in the hours that they worked per week. They will be issuing the details of this very soon, sometime within the next few minutes, I hope. Let me also, we've had questions about unemployment and who is eligible. Governor DeWine, along with Governor Inslee of Washington, Governor Dunleavy of Alaska, and Governor Pritzker of Illinois, today sent a letter asking President Trump to immediately unlock existing federal funding in the disaster unemployment account, declaring that would declare a major disaster and make funding available for 1099 or other types of employees who currently are ineligible for unemployment, or to ask Congress to make this funding available critically for the prompt relief that we need for these employees. This is incredibly important that the federal government step in and help us serve these people who are displaced by the circumstances that we confront in the economy as a result of the actions that have been taken to protect our health and safety. On a bit of hopeful news, I know that the governor has really asked the educators of this state to do all they can in this interim time period to help make sure that learning continues in our schools. I was in the last 24 hours contacted by Hilliard Superintendent John Marchhausen, who's on the governor's workforce board, and he explained to me that they are doing great at distance learning in Hilliard, that they have over 16,000 students a day logged in to participate in school. And to be logged in, you have to, or to count as participating, you have to actually log in and do your work. You need to make sure that you're submitting the work that your teachers have asked you to submit. It really is quite stunning, the great work that they have done there. Yesterday, they had over 16,703 students, I guess the number was, logged in. Their average February attendance was 15,575. So not only are the teachers and the administrators in Hilliard embracing this, the teachers are calling the students just to make sure they're getting them involved, but the students and the families are responding even at a higher rate than they did normally in the month preceding. So it's just one case, but I like to highlight the cases to show that it's possible and that our educators and our families are taking their education seriously. Super important, and I know that that other schools around the state are doing this, and all of those educators to be commended, because they had to turn this around quickly. They find out at the end of 1 week, and many of these schools by the beginning or the middle of next week had these services up and running. I want to also add some business best practices. The governor talked about his enormous responsibility to find the balance between the health needs of the people of our state and the economic and business and work needs of the people of our state. And over the last 24 hours, actually 48 hours, we've been in touch with lots of businesses asking for best practices and imploring and frankly demanding that they execute these best practices. And some of these you've heard before, but I will take the liberty for any business person who does not know exactly what we're talking about to hear these once again. Businesses are taking the temperature of their employees if they have that capability at work or before they go into work. They're asking employees to do that at home if they don't have that capacity. They are dedicating people to specifically clean all of the surfaces, door handles, rails, all the things where somebody might touch them. They have adding dedicated personnel to clean those surfaces. They are removing chairs from areas where they're too close together and where people could congregate. They're staggering breaks and lunch areas so that people don't congregate in one location. They are carrying out the 6-foot rule. And I know that one suggestion that we had from a small business that they did, coffee shop, we don't want people, we have carry-out business and delivery business going on at our restaurants. We don't want people congregated tightly in lines. They put pieces of tape down on the floor with the sign that says, every 6 feet, please, respect one another. And that's capable, anybody's capable of doing that who's similarly situated. They've asked employees to stay at home after work and to not travel outside of the workplace. If anyone is exhibiting any symptoms, they immediately send them home. Many businesses have gone to A and B shifts so that they can spread out the number of employees. They might have one group of people work during the day and the other group work in the evening so that they can avoid tight congregations. People have also identified an individual at their particular facility or in a particular part of their facility to be in charge of enforcement of these rules, to own it, to make sure that the rules that they establish are being implemented system-wide. They are making sure that there's available sanitizing supplies for their employees. They're banning any gatherings without personal spacing. We see that here in the State House when there are meetings that go on where you have to spread people out so that they are not close together when you're doing your work. No community gathering space. You may have a coffee maker where people gather. No more. You got to stop that kind of stuff. You can't have people going in to the same location, gathering without it being clean and sanitized. No sharing equipment without it first being disinfected. And obviously the one that Dr. Acton and we all talk about all the time, washing your hands and not touching your face. These are all things employers are doing to make sure that they're acting responsible. But as the governor noted, he and I both get these messages of employers who aren't doing these things. For those of you who are, keep doing it, keep leading. For those of you who aren't, you are acting irresponsibly and you're putting us all in jeopardy, and it needs to stop. Grocery stores. Have been talking with grocery stores over the last 24 hours. They are all hiring. They are in some cases even offering bonuses for people who are working there and people who will sign on with them. They are essential to our supply chain, and they ask that everybody be patient and cooperative and not treat their employees or other customers with, or don't fail to treat the employees or their customers with respect. We have to respect each other. And that brings me to just a final couple points I want to make. One of these grocery stores told me about literally a fight breaking out between customers over toilet paper. Over toilet paper. Come on, folks. We have to be better than that. We have to be better than that. We got to treat people, got to treat each other better than that. We got to respect people in their workplaces. But I'll also tell you another story of a courageous state employee. This person is vital to keeping the technology behind that unemployment system up and running. Over the course of the last week, they had a loved one in their family, a sibling, who was suffering from cancer, who was on their deathbed, and they chose not to go visit them because they had to keep the system up and running for those tens of thousands, ultimately hundreds of thousands of people who need it. It was a selfless act. I want you to put those two back to back and think about it. Which side of this do you want to be on? Which side of this do you want to be on? How do you want to remember yourself as we went through this? Because tough times reveal our character. They'll reveal us as being selfish or selfless. And that's also true of our society. Think about this in those terms. How do you want to think about yourself on the backside of this when we got out? Do you want to remember yourself as somebody who contributed to the good of our world, to the good of our state? Or do you want to be fighting in a grocery store over toilet paper? We're better than that. It's time to lift our spirits to the calling of our better angels. And I know that we're capable of doing that. And so those of you who are, thank you. Inspire others.
Well, as we've said, today is certainly a somber day. And both John and I have pointed out some places where our fellow Ohioans maybe could have done better. But let me just say that what I'm getting every day from people throughout the state of Ohio is that they are doing a good job. They are patriotic. They're doing what they need to do. And so we just appreciate that very much and ask people to continue to do that. Yesterday I talked about likening this to Pearl Harbor when we'd been attacked. And today I would want to read you something I received. I called upon all Ohioans yesterday to fly their flag. I see that a number of you are doing that. Please continue to do that. Those of you who have not, put the flag up. We're all in this together. We have been attacked, not by a foreign enemy, but certainly by this god-awful virus. But I woke this morning to an email that had to really make me smile. Let me read it. Mr. DeWine, we do not have an American flag to hang outside our home. Today, after your news conference, my 7-year-old daughter made this flag for our house in honor of your request. So I would like to thank 7-year-old Elena in Radnor, Ohio, for the beautiful flag.
Great.
Great work.
Wonderful.
Be happy to respond to questions.
Thank you, Governor. Jim Province with the Toledo Blade. You mentioned that we've entered a new phase of this crisis. Is the response to the death any different than a suspected infection? We've heard from some first responders that were concerned that they did not hear sooner about this so that they could have been tested.
Okay. We'll let Dr. Acton take that on.
Yes, Jim, the response would be very similar. And the second, it's very important, and I'll say this, to nursing homes, to hospitals, to anyone who is encountering someone who you suspect or is diagnosed with COVID, reach out to your local health department. In hospitals, they have infection control folks. Sometimes people forget those folks exist. The sooner you reach out, the sooner that investigation starts. And as you can see, some things go in a different pace, and I think in this case, it was a little later in notifying. So the second that starts, they get out and start going to every contact. So it's really important that we engage our local health departments in every investigation.
And I know we've been restricting who can get a test. Does that change now that we know that there's been a death?
Yes, you know, when there's a cluster or a death or a person in that sort of situation, we know there are those contacts. They will also be considered. And then they're also taught what to look for Again, our testing, I'll have more for you tomorrow. I'm talking to all our hospital CEOs a little bit later this afternoon. We're all talking about, the issue on testing has been put down to the states. My emergency operating team is looking at what all we can do. People are inventing things, but right now, first responders, healthcare workers, people at high risk, certainly people associated with a case like this would be the people to go to first. And I just want to say one other thing. It's important to know that most of us will stay home with this virus. We might not even be tested. You hear that called the mild to moderate group, but I don't want people to take that so lightly. When you get this, a lot of people, from what I'm hearing now, and we hear more stories every day, feel pretty awful. It might be up to 2 weeks of feeling awful. So, I don't want to make it lightly. We call that, just because you stay home doesn't mean you don't feel good. And really work with your provider to help you get some symptom relief with that. As we said, it's the 20% that are going to be really pressing in on our healthcare system. And there might be people, even in a nursing home, that stay and convalesce in place, even knowing they have the disease, but they're not needing hospitalized. And similarly, it'll be comfort measures and supportive care. And then you just watch for symptoms that make you think it's more urgent to go to the emergency room.
Thank you.
Hi, Dr. Acton. Molly Martinez, Spectrum News. You said earlier this week that, if you begin to show symptoms and you're otherwise healthy, stay home, just assume you have it. But we've been getting emails from viewers saying that they have been tested and it's been weeks and they still haven't had any results from those tests.
Boy, our laboratory is turning tests around in 24 hours. And I just want to say again to folks out there, even hospitals, we really need to use the ODH lab when possible, because I think some of the companies that people are shipping out to are way behind. They're prioritizing. Remember that there's a lot of prioritization of resources based on the cases states have, or if they're one of those really hot zones out on the coast right now. And the thing is, here in the Midwest, it's been made light of, but this is everywhere. This community spread is everywhere, and we can't show you a number of cases that we haven't been able to show. So it's really important to take advantage. We have ramped up testing capability. We don't always have the test kits yet, but if that test is done and you want a quick result, get it to the Ohio Department of Health laboratory, and there's information on our website how to do that.
Thank you, and thank you for your work.
Thank you.
Kevin Landers, WBNS 10 TV. Governor, you mentioned about the bad actors and businesses in our community. We are getting a lot of emails at our station specifically regarding call centers. Are those the businesses that you are receiving complaints about as well? And to Dr. Acton, regarding pharmacies, they're among the last standing, and because they're the most easily accessible health professionals, patients are coming in with symptoms and understandable questions, and the pharmacy board is asking for pharmacy benefit managers should immediately cease all audits while the Declaration of Independence Declaration of Emergency is in place, so that they can provide easy access to patients without doing audits, and that patients don't have to come in to get their prescriptions, and people feel that may be another concern. Thank you.
As far as the call centers, the complaints I got did include call center, but it certainly was not confined just to call centers. It was a wide range of different types of businesses.
And I'll talk to our partners in pharmacy and look into the kind of policy change you're talking about. A lot of regulations. I told you a long time ago we're going to be breaking rules and making things easier for everyone to do what they need to do. So I'll definitely take that back with me. But also, I know there's been some news about medicine, mainly anti-malarials out there. And I've been talking with the pharmacy board in terms of how to handle that in a rush on those drugs to make sure that we don't have that in the state.
Thank you.
Oh, sorry.
Hi, Laura Bischoff, Dayton Daily News. Governor, if businesses continue to act in a reckless manner and they are not abiding, what is your next step? What is your next intervention that you'll put in place?
Well, I think people can imagine what that next step would be. So, I've not hesitated in the past to close businesses and other operations if they are a threat to the public. So the safety of the public has to come first. There's a way we can do this, but we have to do it. So, I think I've demonstrated that, I'm going to put the safety of the people first. And we try to get that sweet spot. We try to balance it. But I'm going to err on the side of protecting people. And that's, people can be assured that, everybody can be assured that my decisions will be based on that.
I had a real quick question for Dr. Acton, just to clarify. If someone gets a negative test on COVID now, it doesn't mean that like a week or two from now they can't get exposed to it and then
That's
have
right.
it. Okay.
That's right. And early on in an illness, it depends on the viral load. And so sometimes really, really early on, we've heard anecdotes of that not showing positive yet. And of course, you can still get it, even though you tested negative one time. And that's why that use of testing it's not something that we would all get. Now, surveillance, which we'll hear a lot more about, which is just seeing the level of it in a community, ultimately we will be looking at testing people that are asymptomatic once we have more testing capability.
Thank you.
Hi, Jessie Balmer with the Cincinnati Enquirer. I guess in light of what we know about the importance of physical distancing, can we safely hold an in-person primary this year, and will you be recommending mail only instead to lawmakers?
Well, this is a discussion we obviously have with the General Assembly. We're kind of on two dual tracks at this point. We've got a case in court and we've got a General Assembly coming in. But I think that at a minimum, we would want a significant enough time for people to be able to obtain and return absentee ballots. It's a two-step, as you know, a two-step process. You've got to fill it out. They got to say if they want a Republican ballot, Democrat ballot, independent ballot. They got to ship it in. Then it's got to be sent back. Then they got to fill it in. Then it's going to be sent back. So we don't want to do this overnight. At the same time, we're conducting this when a war is going on. I mean, literally, we're conducting this when we're fighting the virus, and we know that there'll be more and more of our fellow Ohioans who are becoming sick. And so having enough time in there is very important. Whether we can do it, in regard to an in-person election, I don't know. I think the most important thing is that people have ample time to be able to vote.
Governor, this is Ben Garber from ABC6 and Fox 28. The governor of Illinois is expected this afternoon to issue a shelter-in-place order. I'm wondering, what would you need to see in order to consider doing something similar? And also, have you been coordinating with neighboring states, the governors in those states, to make sure there's a more unified response, since some of our border communities, it may be great to have one set of restrictions in Ohio, but if the same is not being done in Indiana or Kentucky or Michigan or Pennsylvania, then maybe those restrictions aren't as effective. Are you coordinating with them?
I talk to governors usually once a day, somebody. Sometimes we're on conference calls. So there is a lot of sharing of information, sharing of ideas. How do you handle this? How do you handle that? So that certainly is going back and forth. I mean, you use the term shelter in place, and that's, we can use maybe other terms as well. But many Ohioans are doing that, and we're asking any Ohioan who can do that to do that. It's the wisest thing to do. It's the safest thing to do. And, I would suggest everybody who has the ability to do that. Now, there's certain people who have to be out. Nurses have to be nurses. Doctors have to be doctors. First responders have to do what they do. And people who work in nursing homes, people who work in our prisons. But we've asked state government, everybody, all my cabinet members, trim that down. People can work from home. They need to be working from home. Only the essential. We've asked every business to do the same thing. So in a sense, we have that. We just don't have that for everybody. But even if you would issue an order today, if I would issue an order today, you've still got to have a whole list of people you exempt, or we're not going to eat, or we're not going to, be able to continue to function. So sometimes, it's not all black and white. It's not either shelter in place or not shelter in place. We are sheltering in place, and I would take this opportunity one more time to say to anybody, don't travel. If you're coming back from Florida or someplace, stick around home. Don't go anyplace. We don't want that being, whatever it is, we don't want the virus being brought in, and you don't know, and no one knows whether or not you have it. But for everybody else, if you can stay home, you need to stay home, and that's just the wisest thing to do.
Thank you.
Hi, it's Andrew Welsh-Huggins with the Associated Press for Dr. Acton. Why are there, it appears to be significantly more male patients at this point than females? Does that represent a pattern of testing geographically, chronologically? Does it represent some kind of reaction to the governor's orders and your orders to stay away from large crowds by gender somehow?
I've asked myself the same questions, and my team's going back. They're looking at a lot of data from other countries as well. And I saw that same predilection in some of the China data. And I'm very curious to find out, this is not enough data. This is not a sample size that you could really draw any conclusions from. There was some, women are following the rules and maybe men, we've had, are there other explanations for this? Why would that be? But this is just too little data. It's skewed who we're testing and not testing. It's not uniform across the population. So we don't have an answer to that yet. But it's part of the typical demographics that we give, including the age range, which again, even medians can be very skewed by numbers of cases. But I have to say, we are seeing in this country, and there is some good data that was out in pediatrics and elsewhere about young people getting this and getting sick. So I just want us, teenagers of every age, I've told you the 1 in 250 that die of 40 to 50-year-olds, and we're seeing a lot of younger people getting sick. So I just want everyone to take that seriously, knowing that we'll learn more every day, every hour about this. So thank you for that question, though. I'll be with you when we find the answer. Yeah.
Thanks.
Dr. Acton, Mike Campbell from WHIO-TV in Dayton. At the Washington news conference today, the Vice President said that they were reaching out to states, making it easier for them to get medical supplies from the federal level. I wanted to ask you if that is actually happening, and then also if you can talk about how many masks and ventilators you have on hand versus how many you'd like to see for the need coming down the road.
So I absolutely, and I've been promising folks, we're doing an inventory right now. And it's one of the things I'll be talking to the hospital CEOs and CMOs about in a little bit. So we're going to share the data as we have it, because we're trying to map it across the state. We're also drawing in, as you know, a lot of supplies from the non-essential surgeries that have stopped and other things that are coming in. One of the interesting things the president did that I think might have gone unnoticed is this taking of the construction industry supply, which is fairly large. And I also want to say that a number of major businesses that reside with headquarters in Ohio have said they have access to some supplies. So we are actually creating, a lot of this we're creating for the first time, a whole logistics stream, trying to get a supply chain. This is not part of my normal public health expertise. I've been talking to people who have done this for major corporations. I've been talking to some people who are wanting to help us invent software to track it. But it's going to be an imperfect system. But again, notify your EMA locally if you have supplies. We will definitely take them. We do anticipate severe shortages, so we're taking everything we can get.
Thank you.
Hi, Governor. Jeremy Pelzer at Cleveland.com. I wanted to see if you had an update about closing or limiting daycares, and if so, how you determine which should close and which should stay open.
We're not there yet, but as I think I indicated yesterday, a number of the children in daycare are already been taken out. We've encouraged people to do that when people had the ability to do that. So our daycare numbers are down significantly. I'll try to get to you those exact numbers tomorrow. We're basically moving towards a situation where we're going to allow the hospitals to establish their own daycare if they need to do that. Again, it's coming down to only essential, people who are essential. What we want to make sure before we issue the final order to close the other daycare centers is that that child has somewhere to go during the day. So that's coming.
Isaac Dreyer from WHIZ News. Have you or are you considering any interstate travel ban? I know you've suggested that people quarantine themselves when coming back from like spring break or something like that, but have you considered a ban?
Yeah, I'm not a constitutional scholar, but that's basically within the realm of the Congress and the president. We can't put up a barrier on 70 or 71, and we just can't. We can't do that. So, but we can certainly encourage people, or, if you're coming back from vacation, you live in Ohio, that's fine. Go home though. Stay home. Don't go around, go out for, because we don't know what you're bringing back. So.
Thank you.
Andy Chow, Ohio Public Radio and Television State House News Bureau. Governor and Dr. Acton and Lieutenant Governor, if you want to touch on this too. For the past couple of weeks now, your administration, journalists, we've all been trying to spread the word that this is something to take very seriously. You have to stay at home. You have to practice social distancing. And like you said, we've already heard cases of people not taking that seriously. But on the flip end, there are people in Ohio who are taking that very seriously, almost maybe panicking. What advice do you have for people to try to balance taking this seriously without freaking out?
Well, I'll start, and this is more in Dr. Acton's realm probably than mine. But, I think that if people do the things that the doctors are telling them to do, they've done everything they can do. And, they should then go on about their life. Now, it may be a little different life, but they'll be reading more books, they'll be watching more Netflix, they'll be, taking walks. Nothing wrong with going outside, taking walks, keep the 6-foot distance. But this is not, we can't panic over this. And because we're going to be doing this for a while. And so what I would just suggest is that people get into a routine. Most of our life is controlled by routine. Well, we got to change our routine. And come up with a routine that makes you happy, and that is consistent with how you want to live, but it's also consistent with the rules now that we have to live under to make us, to make us as safe as we can. So I think it's people kind of getting used to it. It takes a little while to get used to it. But find some other joys. I know some people have been emailing Fran about her chicken and noodles, and they've been making noodles. Well, somebody sent her a thing yesterday, so I'm getting ready to make the noodles. And somebody else said, my mom and I were watching you, and we decided, okay, we're going to go cook right now, go in the kitchen and cook. So, people who are already in a house, they're already in a house. They're already living together. They're already together. I mean, people can do things. Write a letter. As Dr. Atkins said, the social. We don't want social distancing. Look for more opportunities to connect, but just not physically. Doctor.
Well, I just gotta grab one thing. First of all, and maybe I've never said this enough.
You're Matt Polder.
Matt Polder. This curve's going to go down. This curve, we are on the slope now, and that's been the hard thing, at least for me today, is I know we're ramping up to seeing this, and this is the time we want you to take it very seriously. This will last, and we don't know exactly how long, but it won't last forever, and it will pass, and we will have treatments, and maybe even sooner or later, some things that might help us. So I want people to know this isn't forever, but it is shocking, even to me and my family, to change who we are. And it's hard to slow down, and just not be in those routines. And a lot of us have been sort of mindlessly chugging along in our life, and this is just disrupting how we know ourselves. And that is going to be uncomfortable, but it's not always a bad thing. And even a little stress is not always a bad thing if you can allow it to open you up, maybe to some wonder again. We have lots of tips, though. We know that there are people that are struggling all the time. On our website, coronavirus.ohio.gov, my favorite colleague over in mental health and addiction, Lori Chris, was here once before and gave some great tips, and she's going to be collecting those. I think the folks out there who are starting the what-to-do lists, we've been trying to design some, but I think it should go viral, that helping each other with ideas of what's changing and what's good in our life, or maybe what we're waking up to. I remember September 11th when it happened. This is a longer version of a sort of a waking up in a shock. But I just remember the strange, and for those of you who remember this too, odd sense of everything that has been political or ridiculous in our life just fell away in a moment. And I hope we'll allow that to happen for ourselves, because this is slower and we can get caught up in worrying about things, but I hope we'll allow that falling away to happen and kind of wake up to something more meaningful.
Governor Eric Halpern with NBC4. Earlier today, the president said the Department of Education is not going to be enforcing standardized testing requirements. Any update on what the state is going to do when it comes to those standardized tests?
Well, I think I've already indicated that, we were not going to have testing if that was going to get into the way of what we're doing. Look, we're looking at, we initially said 3 weeks. We know that's going to be longer. This very well could extend throughout the whole academic year. But as John indicated, we're getting some very good reports back with young people who are learning. My prediction is we're going to, figure out different ways of learning, and the distance learning is going to get perfected maybe better than it has in the past. So, out of every cloud, there's some sunshine, and these kids are going to be okay. And I thank the teachers. Thank you for what they're doing. But we're not going to let testing, we're not going to fixate on testing. If that's not possible, we'll certainly talk to the legislature about it. But if it's not possible to have testing, we're not going to have testing. We're not going to worry about that.
Thank you.
Adrienne Robbins, NBC4, and my question's for Dr. Acton. Obviously, with the news of Ohio's first death today, does this signify a new phase that our state is into you? And at this point on the timeline, should we expect to see that death toll rise now?
Yes, unfortunately, yesterday was a very hard day for me. I'll just admit it, and this morning, because I know we're entering a little bit of a new phase. We knew we'd see these deaths. We've known this will happen, but it's still very hard to take when it happens. And I think we will see more. So, but I just want to, again, share my condolences to the family that we're all going through this together. Every single life matters, and we'll be with you through this every step of the way.
Thank you.
Hi, I'm told this is the last question. This is Max Philby with the Columbus Dispatch. Dr. Acton, I checked with some local hospitals today, and it sounds like so far they're not all seeing much of a spike or a surge in cases or patients yet. Can you tell us a little bit about when we might expect to see something like that in Ohio?
That's right. I think, I can't tell you how, again, amazed I am by how the hospitals and others are just stepping forward in unprecedented ways. And so it's going to happen in a community like we're seeing. There's a hospital involved in Miami County that, that's the hospital that's being affected right now, taking in some patients from the nursing home. And it will happen like that. It will be, as I said before, we won't have one spot in Ohio, but it'll affect each community a little differently in due time. But I assume that it will affect most, if not all, communities at some point to various extents. And that, I can't predict how that will unfold. But we know that will happen. And so right now, many of our patients, the numbers I had, I think today of hospitalizations, we know that our hospitals are at 70% capacity. We can still handle that. And hopefully, if we keep doing everything right, and we slow down, we flatten that curve, that gives our hospitals, our nursing homes, and everyone else the best chance of riding this out comfortably. So it makes a difference, everything we're doing by staying at home.
We look forward to seeing you all tomorrow at 2. Thank you.
Thank you.
All right, we just heard from Governor Mike DeWine and Dr. Amy Acton there that we have entered a new phase in the spread of the coronavirus, as we have learned about the first coronavirus-related death just today. So we continue to follow the very latest information for you right here on ABC6 and ABC6onyourside.com. Anytime we get a major update on COVID-19, we're going to send it out in an alert on the ABC6 News app. You can get updates as well on our website. We'll be back tonight for ABC6 News at 5.
In love is someone who's going through something similar to you.
I think that's so true. And what is so special is that, you know, the Olympics brings all these countries, all these sports together, all these languages. People can't even necessarily communicate in the same way that we're used to.